Mayor, boy, we've been talking a lot about vaccines and COVID and trends, both positive and negative. And the mass vaccination site really ramping up. How do you think the city of Seattle is handling vaccinations at this point, especially when the doors open for everybody next week?
Look, I think we've done a really great job, but not just standing alone as a city. It's because we have great partners. I can't say enough about Swedish Hospital helping us stand up Lumen, the community-based organizations that had make sure that we're getting the allocations for the people who need it the most, the pop-up clinics that we're doing with community-based organizations, as well as the work by the firefighters and other city employees to set up the North Seattle, West Seattle, Rainier Beach. So I think it shows that when we work together, we can get great things done. And yesterday was really a marquee day. We did almost 8,000 vaccinations. We're doing 30,000 this week. But the problem is, I mean, that's the great news. The harder news is we have over 100,000 people on the wait list. So I know that there's many people out there, they're frustrated. They want to get vaccinated. They've been on the wait list. We know we will get more vaccine eventually. We're not getting as much as we want. I have to really thank Patty Murray and Pramila Jayapal, who have been really staunch advocates for us to make sure that we get more vaccine, because we're seeing that the pharmacy program that is serving the rest of the country is not working in Seattle. We're not getting the doses we need through pharmacies. The allocation to the city, the state's been great, and King County Public Health been great, but we need more. So we're hoping that we can continue our efforts. I think we've done a great job. Everyone I know who's been through Lumen Field or one of our sites gives it just great ratings. Disneyland's opening up again in a week. I would say right now, Lumen Field is the happiest place on earth. The volunteers are happy, the people getting the vaccinations. It's really, I think, a great way for us to come together as a city around hope instead of around all the difficult challenges we had over the last year.
What kind of planned communication is there for getting teens in there next week? I mean, what's going to be the capacity to bring in people over the age of 16? Because as you know, the B117 variant, it appears as being easily transmitted through young people. And right now it's really hitting the upper Midwest hard, not necessarily in our state, but I mean, what kind of communication, what kind of availability will there be for people over the age of 16?
So there's three things I want people to hear. First is we're not out of the woods, and we are seeing the variance increase here. And it is really important for people to continue to be careful. You have to wear your mask, keep your social distance, and not have all these gatherings, particularly in the youth, because it may be the younger people are getting it now, but the disease doesn't stay contained. We've seen in other outbreaks that if it starts with the young people, pretty soon it moves to different demographics. So number one, we need people, please, please, please keep up what you're doing, because we are so close, but we need people to continue to be safe and exercise that good judgment. Number two, we're going to get as much vaccine as we can. And we've created this list. People will not get an email from us every week, but we will prioritize on the list the people by phases. So we'll want to make sure we continue, for example, to get our seniors vaccinated when they're eligible. And we'll go through. But also, we're now seeing that the number of people are going to other locations. They sign up on our list, but they go to other locations and get their vaccines. That's fine. That's smart. If you have the chance, take your name off our list so we know you're not on there anymore. We've seen people even go over to Eastern Washington, where there's thousands of unspoken for appointments. And so there's getting to be more. I also want to say, though, that we have to, as a city, continue to be focused on equity, because not everyone can jump in their car to drive to Yakima. Often there's language barriers. People aren't connected to the healthcare system. They don't have the internet. So we're working really hard to make sure that we're getting those people who have been most impacted by this virus, our communities of color, the chance to get vaccinated.
And that is all said, while the numbers, the COVID rate has been increasing in King County, the infections have been going up over the last week in particular. Are you worried at all that King County is going to have to roll back to phase two?
Yeah, I think you and I talked about this before. We've been watching this really carefully. I look at the data every morning. I talk to public health. I've been speaking with the governor. I'm concerned we're seeing a little bit of a plateauing of the numbers, but we know now that the variants are taking hold here. They're more transmissible and they will drive these rates up. So again, we'll carefully watch it. If we have to dial back, the governor obviously will make that decision. And we're going to be in this period until we get enough people vaccinated where we are doing this, move forward a little bit, maybe move back. But it's all the more reason, I can't say it enough times. People have to continue to take the steps. They got to wear their masks, wash their hands, not have those gatherings with friends as much as we want to. And it's even harder with this nice weather. As the nice weather comes to Seattle, everybody gets outside. We want to be with friends, but please, I'm just really hope people are being careful.
And what's interesting about these numbers and vaccination rates, I do remember you and I having a conversation at the beginning of this year about the idea that everybody who wants to be vaccinated will have that opportunity most likely by June. And now I sat in something yesterday with Dr. Gupta from the UW modeling lab, who showed charts suggesting that he believes if vaccine continues to come through the way it has and people continue to model the same behavior, that the pandemic could be over in certain terms by June. That his charts, his modeling shows that the rate of infection goes down, drops off by June. Do you share similar hope with that?
I share the hope, and I haven't seen the models that Dr. Gupta. I have the strongest admiration for his work. But what we're seeing right now in terms of the vaccination rates and the amount of supply of vaccines we're getting, I still think it's going to take us some time to get people vaccinated in the city of Seattle, unless we have a huge influx into Washington State, King County, and Seattle. We won't reach that threshold by which we feel like um, we can start really reducing the number of restrictions we have. I think even with vaccinations, we should expect to see some COVID restrictions through the rest of this year. I think you'll see mask wearing in public places, for example, continue for a period of time, particularly in the fall and the winter. It's going to be important with the new flu season. So I think that, you know, we're closer, but we still don't have a way to completely prevent this virus, and it's finding ways, to change and mutate to make itself more dangerous.
All right, my last question's on a different subject, and that is on this charter amendment that's now being floated. The Compassion Seattle folks about homelessness. I guess it's an open-ended question. You've probably had a chance to look at the language at this point. One of the things this group is saying is they're doing what city leadership hasn't done in addressing homelessness. Just what's your reaction to the charter amendment?
So a couple of things. One, because of the prohibitions on using city resources, and it's a ballot measure, I can't speak on the pros and cons. I can say that, we as a city will be analyzing what we think the budgetary impacts will be for each one of these components. We're in the process of doing that. And that's information, obviously, we would have to share with you and with others, because there's a lot of things in this proposed initiative. But because it is on the ballot at this stage, I can't, as mayor, comment on it one way or the other.